Well, greetings, everybody. We are having this interview. My name is Austin Hoyle. I'm the pastor of Hawkins United Methodist Church. We are recording this interview with two members of Hawkins, and they're also members of the advisory team. They're scientists and health professionals who work in local hospitals. Karen, first, I would like you to introduce yourself. Tell us where you work and specifically what job experience you've had, and that helps you to be able to speak and give us a wider perspective on what's happening in our overall society for COVID-19.
Okay, is my internet connection good here? Good enough?
Yes. Yeah, you're coming across very well.
Great. Okay. My name is Karen Bascom Lambiot. I'll start with my disclosure. I am here as a private citizen. I am not here as a direct representative of my employer, and anything I say should not be construed as a statement from my employer. That said, I work in the Communications and Marketing Office at the University of Mississippi Medical Center. I am their science writer, which means I spend my days trying to write news releases, website material, anything we do that communicates research science, clinical trials, education related to research that happens at UMMC.
Great, great. And can you answer? Can you introduce yourself?
Yes. My name is Ann Perrier, and like Karen, these are my words. They are not the words of my employer. I work for the local hospital here in Vicksburg. I've been a staff pharmacist there for about 38 years. Currently, I work PRM, but I have been working during this COVID epidemic, so I have an upfront view of it.
All right, great, great. Well, the reason why I've asked Karen and Ann to speak to me this evening and to enlist this and to release this to all of y'all is so that y'all can kind of gain a greater perspective and kind of see what it is that we're going through as a society right now with COVID-19 in our midst. So I'm pretty much just going to ask them questions and allow them to answer in the best possible way that they feel that they can answer. The first question I'm going to ask is, how has your faith guided you in your role during COVID, and how can the church support you?
Well, I'll jump in. I think that what my faith has done during this epidemic has shown me that it's not the easy thing, not always the right thing. So I find it difficult sometimes to wear a mask all day. I find it difficult to see people make decisions that they might not otherwise have to make. And even out in the community, when you see people who you know are not following the guidelines, it kind of upsets you knowing what you go through at work all day. But your faith is there. I don't think I could make it through something like this without a faith-based life. It just wouldn't be possible.
Okay.
Well, good.
Should I go?
Yeah.
All right. So I'm working with two guiding principles here. Do what is good and learn what is true. So in this case, good is following guidelines as best I can, wearing masks, avoiding crowds, being able to, and in my job, being able to communicate truth and what we know to be the truth as best we can. So in my personal life, I'm searching out the best information I can get to understand what's happening and how to make sense of it, and what are the most reasonable actions I can take and groups can take. And those are two things that come very strongly from faith.
Yeah, definitely. So why it is, do you think a lot of people are not following some of the simple guidances that we're giving, such as wearing a mask? And what do you think, how do you think we Christians should view these guidances that we're being given?
I think we have a lot of proof that the guidelines issued work. Would you agree, Karen, that the wearing
Yes.
the mask, the social distance? And I think that people are tired. They're tired of staying at home. They're tired of, having to conform to something that they're not used to. It's not a habit with them yet. I mean, I think that for the most part, people understand. I just don't think they don't see up front what I see, and they don't have any idea of what not following the guidelines can lead to. A number is a number, and it's a number until it's your number. And I think a lot of people just think it'll never happen to me.
All right. I generally agree. I'd say this is common among public health habit adoption, whether it is healthy eating, wearing seatbelts, getting vaccinated, taking medicines on time. This is a learned behavior, and because this is a behavior that has only been happening in the US for a few months with any sort of public health pressure, it's going to take a while to adopt. So I think part of the reason mask wearing is not as well adopted as it should be in Mississippi and other places has to do with misinformation. And there's a couple different kinds here. First, it's a lack of good or easily understandable information, which is what we had at the beginning of this pandemic when people still weren't sure how masks would help, how social distancing would help, and it wasn't communicated well what we knew about it and what we didn't. At this stage in the pandemic, I think it's more of negligent or deliberate misinformation. People who may know better are not sharing good information, or people are still using sources of information that are outdated, or you may have news sources or social media sources or personal sources in your life that are giving you bad information, whether they know it or not.
Yeah, that's.
And I think that.
Oh, Ann?
I think that as what Karen is saying is true, and that people take what they want to believe and do it. If they don't like what the other person is saying, even though it's true, there's so much misinformation out there that they're just going to follow what they said. Well, so-and-so said this. It's just like, it's human nature to take what you want to do as being said by somebody, and it's what you're going to do, even though you know it's wrong. I mean,
Yeah. And both of you have been having pretty extensive conversations on the advisory team for opening up Hawkins again over the past month or so. How would you apply this to the role of this misinformation or refusing to embrace some of these simple guidelines in terms of returning back to worship and returning back to normal life in the church?
Anne, you want to start?
Well, go ahead. I'm still mulling this one over.
Okay. So I would say for Hawkins, in my experience with our advisory committee, coming up with plans on what to do when we reopen has been very productive and has generally followed what I understand to be best practices for public health. You wear masks, you make hand sanitizer available, you social distance, you limit the number of people who can be in an open space. These are all the things that we need to be doing when we open. There's a big clause on that, and we might be getting to that in a later question, is when is the right time to reopen? I do not think it is the right time to reopen, but everything that we have planned so far as how to reopen when we do it, I think is really good and really appropriate.
I agree with Karen. I do think it's that what we have is a good plan, but I am also in concert with her in that it is too soon.
Yeah. And that I mean, it goes into my next question. Churches across the state, we are struggling with reopening. Our Bishop just sent us and said, and has asked churches whether it is wise for us to reopen and to discern that, and for our context. So what advice, if you could kind of talk to large chunks of churches, not just Hawkins, but churches overall, in our overall society, in Mississippi and the Vicksburg area, caring for you in the Jackson area as well, what advice would you offer them?
I think that for the most part, the curve needs to flatten and then decrease before we even think about it. It's still going up. The cases, the Mississippi Department of Health stats, they're continuously going up. This is not a time to start venturing out. This is a time to sit tight and wait for things to calm down and get better before we venture out to put ourselves and our congregation at risk. I mean, that's just my opinion.
I agree. So since we're talking about flattening the curve, and I'm a science communicator, I want to know that people actually know what that means. So if you look at a picture, say a graph of new cases as they go up, you see an incline and you go up. And when scientists typically talk about flattening the curve, they're not talking about a plateau, which is where you have a sustained level that's just kind of rolling around. Usually it means you've gone down below your peak and you're dropping. Now, some sources I've read on that recommend that you should be anywhere from 2/3 to half to maybe even down to 1/3 of your maximum daily case or something comparable to that before you think, okay, we've really nipped this in the bud. Mississippi has never had 2 straight weeks of state level decline. We got very close at the beginning of March, and we started opening things. We got impatient. So that is something that we need to watch for when we do flattening curves. So churches have a governmental style organization where we have leaders, and we have leaders upon those leaders, and we have groups and committees that can make decisions. And that's very similar to what we have in, say, a secular public government where people can also make choices. And just as local governments and state governments and national governments need to make decisions on how to keep their people safe, churches need to do the same exact thing and use the same to do how to keep people safe, whether that's mandating masks or, closing sanctuaries for a time being.
Mm-hmm. Yeah, what we've been doing for the past almost 4 months now, and
it's so hard. It is so hard.
Yeah, it really is. Trust me,
Yeah.
I never thought I'd ever cancel church for India.
Yeah.
before
This is unprecedented for our generation. Yeah. It's been 100 years since America has faced something comparable to this kind of pandemic that has really been pervasive as far as, what kind of disease it is. It's a lot.
To follow up what you guys are talking about, I hear a lot of people talking about the reason why we have contraction rates going up is because we have our testing rates going up. And also another important metric that I think we need to look at perhaps are ICU rooms and ventilators being used. What are your responses to
that? I know that for a fact that the director, Dr. Dobbs, said last week, testing rates have been flat in June, meaning they haven't gone up or down significantly. So what you're seeing is a true curve, in my opinion, for the month of June. Mm-hmm. As far as ICU beds, you got to remember every hospital in Mississippi does not have an ICU, number one. So, number two, from my own perspective, I've seen nurses worn out from having a full ICU, from where I stand, and also people having to wait, because there is no available bed in the ICU. That being said, I don't know, I just don't know. I just think it's kind of sad that this is happening. A lot of it's because people are not doing what they need to do to keep people safe.
Yeah. Now, is what you're saying, the ICU and ventilator shortage, is that comparable to anything you've experienced in the past, or is this kind of a different thing now? What you're saying, is this unprecedented?
It's unprecedented for me. I mean, we're not anything compared to New York, of course, but for our small facility, we see the drug shortages from people not, from overuse of ventilator drugs and things like that. And that's another issue as well, is even if you had the ventilators, making sure you have the drugs to take care of them. And we've been fortunate so far, to have a little hospital that really works hard to make sure their patients get what they need, and we don't have to ship them. And I just think it's a shame that people don't realize how hard we're working to try to keep them safe, and they don't have the courtesy to help back, or to help us do that.
Yeah.
Kind of frustrating.
I think another thing is really important to realize about ventilator and ICU use. I cannot comment specifically on any hospital's, role in it, because I'm not at liberty to, or I just don't know. But we do know from what we generally know about hospitals is that most of the people using ICU beds and ventilators at any given time in any given hospital are going to be people who come in from car accidents, people who come in with strokes, people who come in with heart attacks. Oftentimes, hospitals are already running at high capacity here on their ICUs. And every single extra person we're bringing in, the excess cases of infectious disease, of respiratory disease that require it, takes up a bed. Which means even if you don't catch coronavirus, if you have a heart attack and you need to go to the hospital and you need to be ventilated for life-saving reasons, you may not get a ventilator. It could affect you even if you never get infected.
Exactly.
Yeah. Very, very, very deep stuff to think about, especially when we think about our own spiritual roles in all of this, and roles that we can play in as a Christian, to be good stewards with what we do have. Thank you so much. One last specific question that I'm going to have that I'm going to ask you guys. When someone at church is diagnosed with COVID, and we do know and we can trace that they have been to the church recently, or that they trace that they contracted possibly the church or the COVID at the church, how does the church need to respond in that type of a situation?
I mean, they need to follow protocol. They need to shut down. There's a whole line of investigation that has to be done, of reporting that has to be done, of tracing that has to be done, to make sure you contact all the people that could have possibly come into contact with that person in your facility. And then you have to, I mean, it's just the protocol they've set out for you to follow. We have to follow that as well.
Mm-hmm.
It's very detailed.
I would agree with that. Yeah. When something happens, you learn someone in your church who has been in a building, you do contact tracing. My understanding is there is some limited capability to do contact tracing well, because of the numbers we are seeing. We had 912 new cases reported as of 6 p.m. yesterday in Mississippi. Contact tracing is hard work, and we don't have the capacity to do it at the level we do, is my understanding. So yeah, if someone's been in any building, church or otherwise, you need to talk to the people who've been in the building. They need to quarantine or isolate. I forget technically which term you're supposed to use, whether you're confirmed infection or not. But anyway, yeah, you clean. You don't allow anyone in the building for a few days. There are some guidelines out there that are good on this. On the more human level, you got to care for that person. You got to make sure their needs are being met. If they're someone who's well enough that they just need to lock themselves in their house for 2 weeks, have someone get on a mask, go to the grocery store, drop some food outside their door, whatever it is you need to do to help that person through that time. I also just want to make another really important point about how people are catching this novel coronavirus right now. You could catch it in a church, you could catch it in a grocery store, you could catch it anywhere. what we're seeing and what we know is that it's happening through something that epidemiologists call community spread, which means we can't tie it to particular events particularly well. Like, I think earlier on in this pandemic, there was a funeral in Northeast Mississippi that was tied to a significant number of cases. Very difficult to be able to find those sort of clusters now, because you're talking about a hypothetical, I go to the grocery store and cough in front of someone at the grocery store and they catch it, and then they go home and give it to their kid, and then their kid goes to daycare, and that kid in daycare goes to, gives it to the daycare teacher, and then they give it to their mother who's in a nursing home or whatever it might be. It's very dispersed. It's not going to come, it's just as likely to come from somebody you walk by on the street as it is from somebody you encounter in any particular context. You know, doesn't mean we should be gathering in places, because it's just as likely to get it there as it is any other place. But it means it's going to be very difficult to track where any particular case comes from.
Exactly.
Yeah, good. All right, well, my final question is kind of the catch-all question. Is there anything, if you could tell any person in a church setting, because we're likely to, release this to Hawkins specifically, but also just some other churches that, and some other pastors who expressed interest in hearing some of your thoughts. Is there anything else that you would like to tell anybody in a church setting as a person of faith, anything else that you'd like to say at all?
I think it's important that we know that God is in control, and that we will do things in His time, not ours. We can rush, we can mess it up, but when it's time, it'll happen, and we'll be able to open and go back to worship. But right now, it's a matter of doing the right thing, not the easy thing. Wear your mask, social distance. It's hard to do when you're not used to it. So,
yeah.
Whatever.
I'd add that because this is a situation none of us have really dealt with before. It was 100 years ago the last time we had a widespread pandemic in this country that would have this kind of spread. We don't know how to feel. And some people are very sad that they can't connect with their church communities how they used to, that that people they know who don't have another social outlet now don't have that they can't go sing in their choirs. And there are people that are mad because they've been following these guidelines for months and it feels like they haven't done any good, or they think that there's perhaps a conspiracy, or they think that there's just so much going on and they just want to throw their hands in the air and give up on it all. There's a lot of feelings, and church is supposed to help us through that, and right now it feels really different, and that's so hard. And I guess whatever a normal feelings you're having right now are normal, but it's also very important, very, very important that we as a church are supposed to act in the best interests of not our churches, but of our communities. And in the best interest of our community, we need to keep open spaces, physical open spaces, closed as much as we can for the sake of our local community and the broader community. And right now, with cases going up, it's the time to, if anything, to make restrictions stronger, not loosen them. So we have to hang tight.
Amen.
Well, thank you very much, Anne and Karen, for giving us these very candid answers to some of these very important questions. I know that there's so much going on. There's so many emotions. There's so much information to take in, and there's so much of asking people to change the very way in which we act in this world, and act in our relationships with other people as well. Thank you so much for coming out here, and for answering these very difficult questions. And best of luck to you. Our prayers have been with you guys since day one for the work that you guys do that's very important and vital for our communities, not just here in Vicksburg, but also for you, Karen, in Jackson, and also just for the entire state of Mississippi. So God bless you.
Bye.